I do agree.
Alright, I'm gonna start with washing my hands. Alright, knock knock. Hey, I'm Zach. I'll be your nurse today.
Hi.
Alright. How you feeling?
Great.
Awesome. So before we start, I'm going to go ahead and give you some privacy.
Alright.
What is your name and date of birth?
My name is Gabby. My date of birth is January 19th.
Alright, I'm going to go ahead and check your armband. Looks correct. That looks right. I'm going to check all the information. It matches the computer. So that's perfect. Any allergies?
Nope.
Nope. She doesn't have a band. It says no allergies in the computer, so that's perfect too. I'm going to compare her mRNN number to the computer as well. So everything checks out right there. So what's going on today? Anything special?
Nope.
We're just in for an exam?
Yep.
All right. Any pain or anything? Just got the needles.
Nope.
All right. All right. I know that I'm going to ask you a couple silly questions. I just have to, okay? Do you know where you are?
I do.
Okay. Where are we?
Orlando,
Do you know what day it is?
April 14th.
Perfect. And do you know who the President of the United States is?
Donald Trump.
All right. You passed. So the first thing we're going to do is I'm just going to get a couple vitals on you. We're going to take your blood pressure if that's okay.
Okay.
Borrow that arm. Oh, we're going to clean this guy. Perfect. Beautiful. Looks like you got a nice 118/78. Perfect. All right. All right. This is just checking your oxygen saturation, just the amount of oxygen that's bound to your blood. Make sure that looks good. And while that's kind of firing up, I'm gonna go ahead and take your temperature. It just goes right under your tongue, okay? Perfect. You don't have a fever, you're at 98.2, so that is absolutely perfect. Looks like your SpO2 is at 99%, which is also really good. So that is awesome. Oops. That's fine. All right, the last thing we're gonna do, I'm just gonna check your pulse real quick, okay? Perfect. Looks like you're about 78. All right, so now that we're done, we got all your vital signs in. We're gonna go ahead and start with the actual assessment, okay?
Okay.
All right, so first I'm just inspecting the scalp. I'm looking for hair distribution, any masses, any lesions. That's pretty much that. Going down to her face, I'm looking at her eyebrows, looking at the hair distribution, again, masses, lesions all throughout, looking for symmetry, they're nice and symmetrical, looking at her eyes, symmetrical, looking for any discoloration, so I'm looking at the The conjunctiva, it's nice pink moist. We've got, looking at sclera, they're nice and white, not jaundiced, anything like that. Looking at the iris and the pupils, round, symmetrical, and even as well. Looking down at the nose, also symmetrical, no masses, no lesions. I'm gonna go ahead and take a look inside the nares. Good, mucosa is nice and red, pink. No polyps, no obstructions. Looking at her mouth looks good, looks nice and symmetrical. Again, no masses, no lesions. I'm gonna have her open up your mouth real quick. Again, I'm just looking inside. I'm looking for the buccal mimosa is nice, pink and moist. Looking in the back, she's got a uvula. Her tonsils aren't touching, anything like that. There's no masses, no discolorations, no lesions, anything like that. I'm gonna go ahead and look at her ears. Looking, no discharge, no discolorations, no excessive cerumen. Looking at the other ones, the same thing, perfect. Next we're gonna go ahead, I'm gonna check her pupillary response. So I'm gonna have you look straight ahead, and then I'm gonna flash a light in your eyes, okay? All right, so her pupils were equal and reactive to the light. We're gonna go ahead, I'm gonna have you look at the pen, it's gonna come straight to your nose, okay? Perfect, all right. Again, her pupils are equal, reactive to light, and they're accommodating well. While we're here and I got the pen light in my hand, I'm gonna go ahead and check your cardinal views. That's 3, 4, and 6. So go ahead and just look at this just kind of looks at the ocular motor function of her eyes. It's the cranial nerves. So go ahead and look at the light. Just follow it with your eyes. Perfect. Beautiful. Perfect. Perfect. There we go. All right. So we did those nerves. Now the next thing I'm going to do, I'm going to go ahead and palpate her skull. Again, I'm going to palpate your skull. Is that okay? Perfect. We're going to go ahead and we're just feeling for any masses, again, lesions, any pain, crepitus, anything like that. Everything looks good. I'm going to come down. I'm going to feel her sinuses. Any pain or pressure?
Nope.
All right, coming down. Pain or pressure?
Nope.
All right, anything?
Nope.
Okay. Next, since we're in that area, I'm going to go ahead and palpate your lymph nodes. We're going to do the preauriculars, postauricular, occipital, submandibular, submental, checking the thyroid, and the supraclavicular. All right, perfect. Next thing I'm going to do, I'm going to check her temporomandibular joint. Go ahead and open your mouth and close. Perfect. No clicking. I don't feel any clicking, anything like that. Now we're going to go jump back to the cranial nerves. I'm going to go ahead and have you, we're going to do the facial nerves. So I'm going to have you smile, frown, puff out your cheeks. Perfect. So facial nerves are intact. I'm going to have you go ahead and open your mouth. Say ah.
Ah.
This is where we would check gag reflex. Unfortunately, I'm not going to do that because I'm not mean. We're going to check her optic nerve. We would check it with a Snellen chart. Don't have a Snellen chart, so I'm assuming that you would pass. Okay. Next, we're going to do the olfactory, her olfactory nerve. So what I'd like you to do is I'm going to have you cover one nostril. I'm just going to have you breathe in, breathe okay. Cover the other nostril, breathe in. Perfect. Now I'm going to have you close your eyes. I'm going to bring something close to you. Just let me know what it is, and if you can smell it. Smell it?
Yep.
Sorry. All right, so she can smell that. So her olfactory is good. Now we're gonna go ahead and we're gonna do her ears. So from right here, I'm gonna have you cover your left ear, and I'm gonna whisper a word to you. Just repeat it for me, okay?
Okay. Orange.
Perfect. Now we're gonna go to the other side and cover the opposite ear. Again, we're gonna do the whisper test.
22.
Perfect. So she passed that. Next, we're gonna do accessory muscles. So I'm gonna have you shrug accessory nerves. Okay. Equal and bilateral. I'm gonna have you open up your mouth, stick out your tongue, and wiggle your tongue around. Perfect. Good stuff. All right. So we did all that. Okay. So next we're gonna continue to move on. I'm gonna go ahead and check your pulse on your carotid. I'm gonna do it only one side at a time. That way I'm not including blood flow to her brain and to the rest of her body. So we're gonna feel on one side. Perfect. And feel on the other side. Perfect. All right, so next we're gonna go ahead and listen to the buoys with the bell. With my stethoscope. Alright, same thing, we're gonna listen one at a time. I don't hear any buoys, so that is good. So I mean, while we're at it, we're just gonna go ahead and listen to all your heart sounds, okay? We're gonna listen to the aortic. Just listening primarily to S2 sounds. Pulmonic. Perfect. Erb's point. Tricuspid. And these two are S2, S2, S1 and 2, S1 and 2. And then we're gonna listen to the outpull for a full minute. Perfect. So your heart rate's about 78 again, so it matches with what we did earlier. Next little test I'm going to do your we're kind of flow into some musculoskeletal. So I'm going to have you go ahead, grab my hands and squeeze. Perfect. Equal and bilateral. I know I'm kind of skipping around, but next I'm going to listen to your lung sounds. Okay. Clean this. So I'm going to listen to her lung fields. Looking out for adventitious sounds, mainly bronchial, bronchovesicular, and vesicular respirations. Just take nice, normal breaths, okay? And while I'm here, I'm going to go ahead and count some respirations. About 19. Just going to kind of come over your arm there. Your arm down the other side. Perfect. Beautiful. All right. You do me a favor. I'm gonna have you sit on the edge of the bed there, and I'm gonna listen to the back to your posterior lung fields. Okay. All right. Mind if I move your hair out of the way
Oh
here?
yeah, sorry.
Just normal breaths. Okay. so that sounds all good. We're gonna do a couple more tests. Just let me know if you feel any pain right here. Any pain?
No.
Good. All right, we're gonna do tactus fremitus. Go ahead and say 99.
99.
Perfect. Say it one more. 99.
99.
One more time.
99.
Perfect. All right, you can go ahead and lean back if you like. Oh, I'm sorry. One more thing. While I'm back here, I'm also looking at the symmetry of her back. I'm looking at the curvature of her spine. It's nice and straight. Everything is symmetrical. There's no scoliosis, no side bending, no lordosis, kyphosis, or anything like that. So, and also her skin looks good. No masses, no lesions, anything like going on like that. Okay, you can go ahead and lean back if you'd like. Keys. All right. So we're gonna go ahead and I don't think I checked your brachial pulses. So we're gonna check your brachials. Okay, brachial pulses are nice, strong and equal and bilateral. I'm gonna go ahead and check skin trigger, no tenting, and cap refill, less than 2 seconds. Beautiful. All right, so now we're gonna move on. We're gonna do your abdomen. If that's okay, I'm gonna lean the bed back for you, just
Okay.
part of my reach. Kind of reaching over you. All right. So if you may, I'm just gonna have you lift up your shirt. Perfect. So I can see your abdomen. Here I'm just looking for any masses, lesions, any scarring, anything like that. Everything looks good, looks normal. We're gonna go ahead and auscultate. I'm starting on the right side and following the large intestine. While we're here, I'm going to go ahead and listen to the aorta, descending aorta, for bruits. I don't hear any bruits, so that's good. Next up, so now that we're done with that, I'm going to go ahead and I'm going to palpate. We're looking for masses, lesions, anything hard underneath the skin. So, and if there's any pain, just let me know, okay? So everything feels okay. If I felt a mass of some sort, I would go ahead and I would palpate deeper, about 5-6 centimeters. Next, we're gonna percuss. So everything is tympanic. In this case, I would be looking for tympany or dullness. Dullness is not good. So. Everything looked checked out, looked pretty good. So we're gonna go ahead and raise you back up, if you don't mind. Oh, if you want to. All right, so next up, I'm gonna go down to the lower extremities. If you don't mind, I'm just gonna hike your pants up a little bit. So we're gonna find the posterior tibialis on the back. Perfect. Equal strength, +2. All right, equal strength, +2. Equal strength, +2. We're gonna check cap refill on the toe. Perfect, less than 2 seconds. So she's got good circulation in the feet. I'm gonna have you push down on my hands. Perfect, now pull back. All right, and her strength down here is equal and bilateral. I'm also gonna check her skin. I'm looking for any edema, any pitting edema. I'm looking for same thing, lesions, masses, anything like that, any discolorations. And then everything looks good. So I'm gonna go ahead and wash my hands. All right, I'm gonna come back in here. Do you have any questions or anything for me?
I do not.
All right. So this is pretty much the end of the assessment. Doctor will be in shortly to tend to you. I'm gonna grab the call light, put it next to her, and then I'm going to exit the room.